Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to another edition of Hilaal Live. My name is Luqman Shadrack, all the way from the Cape Town studios. Thanks for watching, and I have to say congratulations to the Bokke. As a New Zealand supporter, I congratulate them, and yeah, it was a good game. I'm sure everybody's still reeling after the rugby over the weekend as well. But we continue, and today, back in studio, we invite Dr. Samina Parkar. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Jazakallah so much for joining us once again. You've been with us and covering very interesting topics. Today's one is no different. Hair loss, or some people may refer to it as the common cause, alopecia. So what are the different types of hair loss, or the common causes of hair loss?
Sure, we'll cover the causes, and I think the rugby match this weekend, I'm sure, was a cause for a lot of people losing
a lot of hair loss. Definitely, or just pulling their hair out as well.
And nails, I'm sure.
Yes.
But no, on a serious note, so of course the causes are extremely broad, but if I can just, try and narrow it down.
Sure.
Genetic factors, I would say, in no particular order, but genetic factors is one very important cause. So inherited conditions, especially, when it comes to female and male pattern baldness.
Okay,
so that
yes.
plays a significant role of family history.
Right.
And then hormonal imbalances. So the hormonal fluctuations that one sees during pregnancy or menopause can also induce hair loss. And then underlying medical conditions, in particular thyroid disease, autoimmune connective tissue disease, such as lupus erythematosus. These can also contribute to hair loss. And then, of course, side effects of medication, and chemotherapy is a well-known cause of hair loss. And then there are other blood pressure medications that people might not be aware of, such as blood pressure medication, and other meds, and then anticoagulants or, blood thinners, so heparin, warfarin, psychiatric medication.
Oh, wow.
So these are all very common causes for hair loss. And then I would say nutritional deficiencies is a very important and often overlooked cause for hair loss. So a poor diet that is lacking in essential nutrients can all weaken the hair follicle and lead to hair loss. And I'm speaking about vitamin D deficiencies, iron deficiencies, zinc, biotin. And then I would say hairstyling practices.
Oh, wow.
So yes, hairstyling practices. So, the use of, overstyling your hair, the use of excessive heat, chemicals, even tight hairstyles, especially braiding, can all, damage the hair follicles and lead to hair loss. And then one very important and relevant one is, emotional and psychosocial stressors. So excessive stress, any trauma, any emotional turmoil, these can all disrupt the hair growth cycle and lead to hair loss.
I think it's you touch on so many good points there in that opening, because quite a few of those can be avoided. For example, going to have your hair done and not going to a trained professional using chemicals on your hair that could be harmful. I mean, that's just, you're asking for trouble there.
Yeah.
So rather, in Cape Town we say the horror, rather avoid the horror and make sure that your horror is well looked after.
Yeah.
And also you another point in terms of, styling your hair differently. Obviously, we like to keep up with the times, and some people like to, grow their hair or cut their hair in a certain way as well. All those add towards hair loss.
Definitely.
Okay. So what are the different types of hair loss? I mean, are they medically termed, or do you have a medical term for it?
We have various classifications in dermatology, and we can classify them either clinically, we can even classify them histopathologically. So that's when you take a skin biopsy, and depending on the type of inflammation you see or the signs you see on the skin biopsy sample. But let's just use an easy, relatable way.
Okay.
And I would say the first thing to ask yourself when you're confronted with a patient that presents to your practice with hair loss is, do they have hair loss? Obviously, what is their complaint? So yes, they have hair loss, or no, they don't have hair loss. And then you examine the scalp. So suppose they don't have hair loss, but they're complaining of a scalp issue. Then we look for signs of psoriasis, We look for signs of atopic eczema. We look for signs of seborrheic eczema. Obviously, they all differ clinically. Psoriasis tends to be more red and, with the silvery white scale, whereas seborrheic eczema tends to have a more greasy, waxy scale.
Okay.
So that's the cradle cap that kids get when they're
I'm with
babies.
you.
So that's the difference. And then suppose that there is hair loss. The next question we ask ourselves is it patchy hair loss? So are there well-defined patches of hair loss? Or is it diffuse hair loss? So is it hair shedding or hair thinning? And obviously, if it's diffuse hair loss or the patient is complaining of hair shedding, so for example, the patient will say, doctor, every time I brush my hair, I comb my hair, there is a whole lot of hair that's found on the brush. Yes. Or, doctor, there's a lot on the floor, or it's often clogging up my shower drain. Then you know that that's shedding.
Okay.
Or it's diffuse hair loss. And then there is a condition that causes that, and it's called telogen effluvium.
Okay.
And then suppose it's patchy hair loss, where you can actually identify well-defined patches. And then we ask ourselves, is the scalp looking normal in those areas of patches, or does it look abnormal? So if it looks normal, meaning the skin of the scalp looks normal, there's no redness, there's no scale, there's no scarring, then we consider conditions such as alopecia areata, which you touched on just now, which is an autoimmune disease. And then you also get something called traction alopecia, which we often see in women who've braided their hair. Okay. And then we see other things like androgenetic alopecia, which is obviously seen in men and women. It's the normal physiological type of baldness. Then suppose the scalp skin doesn't look normal. Okay, now we ask ourselves, is there scarring or is there no scarring? And the way we tell is by means of trichoscopy. So we have a little tool or instrument called a dermatoscope, and we use that to do trichoscopy, where we're studying the hair and the hair follicles itself. And then if we can see follicular ostia, so those are tiny black dots that we see on the scalp skin, and that's actually the hair shaft exiting from the skin. So it's tiny little black dots or follicular ostia. And if we see that, then we know that it's not scarring because the roots are still present. And then that tends to be either infectious or non-infectious causes. And the infections that would, cause no scarring would be like ringworm, for example. That's just the layman's term for tinea capitis. And suppose that, there is an infection or pus present, then we think of, chronic infections. We think of like a dissecting folliculitis. We think of folliculitis decalvans. I mean, there are a lot of conditions that can cause infectious hair loss and scarring hair loss. And then suppose that there's no signs of an infection, then we think more along the lines of inflammatory skin conditions. So that would be like a lichen planopilaris, which is a variant of lichen planus. Then there's one very long one that's called central centrifugal cicatricial alopecia, which just means it's a scarring alopecia that starts in the center of the scalp and expands outwards, which we see a lot in African women. And then discoid lupus, which is a form of chronic skin or cutaneous lupus that also causes scarring alopecia.
Right. And quite a few of these that you mentioned, I would imagine it presents itself different with different culture groups, but also ages as well.
Yes.
Do you find there's a lot more as an adult compared to children?
So alopecia areata can affect any age. So that is the patchy, the well-defined patches that you see on the scalp, where there's no scarring. The scalp appears completely normal. The hair just, falls out in patches, and that we see in kids. We even see it in adults, and often stress or, emotional factors is a trigger, but it's, it's postulated that it is an autoimmune disease. So you have your, there are different types of blood cells, and we have white blood cells in our body. That's part of our immune system, and they are actually attacking the suprabulbar bulge of the hair follicle, and that's why your hair falls out. So that's, the cause at a microscopic level. But so alopecia areata we see in all ages, but if you take tinea capitis, for example, which is a fungal infection of the scalp that also causes hair loss, we tend to see that more in children. Otherwise, immunocompromised patients, so HIV patients, patients that are on immunosuppressants. So there are obviously different age groups, but I would say there are certain conditions that can affect from kids to elderly.
Yeah, along with these conditions, I would imagine there's quite a bit of psychological trauma damage that can be done in the process as well, because we all want to look good and look
Of
a certain
course.
way, and especially, for example, if you need to be presentable in your job, and that could form a bit of psychological issues.
For sure.
Do you find that a lot of patients tend to have to deal with that as well?
Definitely.
Okay.
Especially school-going kids, Shem, yeah, kids can be brutal
Absolutely, yeah.
and relentless. So I have a lot of teenagers who come in with alopecia areata who've also got, severe psychological repercussions. And then we often try and get a counselor on board as well.
Okay, that's great. We're chatting about hair loss, and we're going to open the WhatsApp line as well. If you have any questions, you're more than welcome to send us a WhatsApp 079 085 2511. 079 085 2511. That's the all-important WhatsApp number. Unfortunately, we won't take any calls. Only WhatsApps come directly to this number in Cape Town. This is the number that we use for our Cape Town studio. You're welcome to send us a WhatsApp, and Dr. Parkar will try her level best to answer those questions. After the break, we continue, but do join us on the WhatsApp line. You are still watching Hilaal Live. Assalamu alaikum. Welcome back to Hilaal Live. Today we chatted about hair loss with Dr. Parkar in studio. The WhatsApp line's open if you'd like to send us a WhatsApp, and maybe if you have an issue about hair loss, Dr. Parkar will give her level best advice on how you could have that treated. 079 085 2511. As we chatted before the break, we heard about various conditions that can contribute to hair loss. And Dr. Parkar, thanks once again for coming in and sharing such valuable information for ourselves and our community as well. We chatted about hair loss, but is there anything that can actually make hair loss worse than what it is? So, for example, I have a condition. You've identified what the condition is, but for some reason, I Google some of my, as we all do. Dr. Google's our first friendly friend that we go to, and maybe it contributes to, to more hair loss. Do you find that as well?
So we do find in certain patients, I think what often happens is they delay seeing a professional.
Okay, that's also true.
And then, of course, trying over-the-counter products, and whether it is available at the supermarket or, just that they acquire from the friendly or local pharmacist.
Or family remedy.
Yes, or home remedies.
Home remedy,
and I think that can often, cause damage. Obviously, if it's too harsh to use on your scalp, then of course that can cause damage to the hair follicles. And there was a professor at university who always taught us, time equals hair follicles. So the longer you take, the more hair follicles you're losing.
Okay.
Yeah.
That's a good one. I like that one.
Time equals hair follicles. So rather seek help or professional help sooner rather than later, I would say.
One of the things you stressed on, and excuse the pun, is stress, that can lead to quite a bit of hair loss or exacerbate your hair loss as well. We do find that we live in times that are quite stressful. It can be family, it could be your job, it could be anything in your community.
The COVID pandemic.
Correct. We have things going on in the world right now where can lead to quite a bit of stress as well.
Yeah.
That's quite a serious concern when it comes to hair loss in your profession.
Definitely. And I mean, it's one of these things that are unavoidable. I mean, we all have stress in our lives, and it's easier said than done, but stress is definitely an important cause. And we see that especially in patients who have telogen effluvium, so that's the diffuse hair loss that I spoke about earlier, where you have hair shedding. By far, sure, the stress is the cause. And then also in patients with alopecia areata, often there is an emotional or social stressor that has triggered it, whether it's, the loss of a family member, whether it's a child that changed schools or relocated, or whether there's parental conflict at home. Stress is definitely, a positive association with hair loss.
We all knew it as hair loss, and I think Jada Pickett Smith probably made it clearer of alopecia and the trauma, the psychological effect that has had on our community for so long as well. I would imagine when clients come to you, the first thing, the question that they would like to know is, how do they stop hair loss? I mean, the various conditions would determine whether that can be reversed or not.
Definitely. So you make a very good point. Obviously, it depends on what type of hair loss they have, if it's scarring or non-scarring, and then of course what the cause for the hair loss is, because of course there are numerous conditions or causes for hair loss, and depending on what the diagnosis is, we obviously approach each condition differently. For example, if it's a fungal or a ringworm, fungal infection of the scalp, then obviously you need an antifungal to treat the infection. Whereas if it's something that's inflammatory, then we need an anti-inflammatory, or whether it's alopecia areata. So there are different treatment approaches, and as I always say, when I come here, that each skin condition has a treatment ladder to climb. And if we were to discuss the treatment, well, of course, there's firstly general measures that we counsel every patient about. So it's important to inform them about the diagnosis, inform them about the causes, the potential triggers that can worsen the hair loss. So I always counsel, I advocate for a healthy diet, because, there are certain essential nutrients that are needed, proteins that are needed for hair to build itself.
Right.
And then the second thing that I tell them is, of course, if there are any potential causes that could be aggravating the hair loss, and believe it or not, smoking is one of them.
Okay.
So then they really need to try. I know it doesn't happen overnight or, quickly.
Easier said than done to quickly.
Yes, absolutely. But then I really encourage them to at least decrease by a little bit each day, and then I try and explain the hair growth cycle to them, and that's very important, because there are a lot of people out there who have hair loss on a daily basis who panic because they think that it's abnormal. So just to put things into perspective, our hair growth cycle is fantastic. It's unique. So we all have about anywhere from 80,000 to 120,000 hair follicles on our scalp.
Right.
And at any given time, 90 to 95% of the hair on our scalp is going through what we call the anagen phase, the active growth phase. And that can last for, from 2 to 6 years.
Okay.
And depending on how long the growth phase is, that would determine the length of your hair. Okay, so the longer the growth phase, the longer your hair. It makes sense. And then about 1% is going through what we call catagen phase. Catagen means breakdown,
Right.
or, involution phase. And that lasts, up to 3 weeks. And then we have telogen phase, and telogen phase is the resting phase where all activity ceases and it's neither growing nor being shed. So the telogen phase can last up to 3 months.
Sure.
Yeah, so for you to lose hair on a daily basis is absolutely normal, and you can lose anywhere from 25 to 100 hair strands that are in their telogen phase on a daily basis. And on days that you shampoo your hair, that number can be doubled.
Of course.
So don't be alarmed if you are losing hair on a daily basis. That's only when it's excessive, then, it becomes a problem.
I would think that clients would want a quick fix when it comes to that. I'm going now to a specialist, and the specialist needs to now fix whatever's wrong with me, so that I can, so that my hair could grow back to the way it used to be. Does that happen as well?
Definitely.
What's your advice? What's your advice to someone where they think
exactly
like
the
that?
growth phase, the hair growth cycle, I counsel them. So of course you can imagine, for a hair follicle to move from catagen phase to anagen phase, it's going to take a long time.
Right.
Because each hair is going through cycles. And it takes a few months for hair to grow back. That's just the normal physiology. So what I often tell patients is that give me a few months, your hair will grow back, but don't expect results in a week or two. By month 4, for example, you should be seeing results. For example, on something called minoxidil. So by month 4, or after 6 months, you'll definitely have more hair, but you have to ask them to be patient. And sometimes it is distressing for them to be on treatment and not see results. But it's very important that they understand that hair does take a while to grow, the same as for nails. And each hair, follicle is going through a different cycle.
Of course.
Yeah. And then in terms of treatment, sorry, you did ask earlier, and I didn't elaborate.
Sure.
So, of course, it depends on the diagnosis. And if we take one of the most common causes for hair loss, of course, I can't discuss each diagnosis and treatment because of time. But if we take alopecia areata, for example, so, you get patchy, which is called alopecia areata. So
Okay.
those are well-defined patches of hair loss that you see on your scalp. The scalp looks absolutely normal. There's just hair missing or lost. And then you get alopecia totalis, when your entire scalp's hair is fallen out, but still it's non-scarring, so your scalp still looks normal. And then you get alopecia universalis, where all the hair, on the body, so that's the scalp, the eyebrows, the eyelashes, the pubic hair, all are gone.
Gone, yeah.
So suppose it's a patient with alopecia areata. If we look at our treatment ladder, then the first thing we try and do is obviously try and get away with just applying ointments and creams. And we usually hit it hard and fast. So we go for the strongest topical cortisone that there is available in South Africa. That would be clobetasol dipropionate or Dovat. And we ask the patient to apply that on the affected area once a day. And that's, a trial of treatment that we give them. And then the next step would be, so suppose they come back, we're not seeing ample results, or there's no improvement, then we consider intralesional corticosteroids, and that means that we inject the cortisone into the scalp skin. So remember I said earlier that what's happening in alopecia areata is that you have your immune system, so your white blood cells called your lymphocytes, attacking the suprabulbar bulge of the hair follicle. That's the factory that's actually producing the hair, making the hair. So you want to obviously stop that war that's going on. So you inject an anti-inflammatory, which is a cortisone. So we inject it into the scalp skin, and that usually helps quite a bit. If that doesn't work, then of course there are other physical modalities that we can use. So platelet-rich plasma, where we draw your blood, we centrifuge it, and the plasma portion of your blood we inject into the scalp. And then of course there are other methods. So minoxidil is very well known. Everybody speaks of minoxidil.
Right,
so that is a medication that is actually used for blood pressure. And what that does is it increases the circulation, the microcirculation around the hair follicles, making the environment more conducive to hair growth.
Brilliant.
So that's the other thing we use. And
Thank
then,
you,
of course,
thank you.
oral medication is also one of them.
Thank you once again. Unfortunately,
pleasure.
we've run out of time. There's so much more to talk to as well. But people
Definitely.
can definitely Google you and find out where you are, and then seek advice on those terms.
Absolutely.
Shukran so much for coming into the studio. Have a great evening.
Afwan, only a pleasure, and thank you for having me.
My pleasure. Assalamu alaikum.
Wa alaikum salam.
That's Dr. Samina Parkar coming into studio, chatting to us about hair loss. If you'd like to find out more, you could Google Dr. Parkar and make an appointment at her practice and get the best advice for any treatment that you require. After the break, we chat to the good people from Fusion Inyameko Foundation about a Quran competition that they had very recently. You are still watching Hilaal Live.